Since April 18th, nurses at UP Health System Marquette and officials at Duke LifePoint have been negotiating a new contract. Tuesday night, nurses gave their elected bargaining team the green light to authorize a strike.
It was a strong majority of the nurses who showed up and voted.
What is the tipping point for you guys possibly to go on strike?
Well, it all depends. That hasn't been decided yet. We plan on going back to the table and hoping LifePoint will come back and work with us.
Last week, the Michigan Nurses Association filed a report with the Michigan Department of Health and Human Services, citing hundreds of unsafe patient care incidents that have occurred at the hospital since January 1st. Nurses say those incidents are due to short staffing, which is the main component of their bargaining talks with the hospital.
They are out there, they know, we know, and we just want them to come back to the table and work and be serious about what we are looking for.
Nurses here have been working without a contract for over a month, and if they were to authorize a strike, they must give the hospital 10 days notice before the strike actually begins.
Our top priority is the patients and being in the hospital. That's what nurses want. They want to be there for the patients.
The hospital did release a statement to ABC 10 about the nurses' vote. Here's part of their statement. Quote, "The Michigan Nurses Association reportedly worked very hard to convince an undisclosed number of UP Health System Marquette employees to vote in the affirmative in yesterday's strike authorization vote. Notwithstanding the reported result of that vote, we are encouraged by the many employees who have expressed their opposition to this tactic by the MNA and who are dismayed by the union's recent public attacks that portray their hospital in such an inaccurate, inflammatory, and damaging light. During this time, as always, you may rest assured that our first priority is the delivery of high-quality, compassionate care to those we serve." End quote.
They say they're there for the patient. I would like them to show us that they're there and they care.
The two sides have 4 negotiation meetings scheduled in September. In Marquette, Jerry Taylor, ABC 10 and the CW5.